So far, we have some information from ERs across the country that has shown a substantial increase in the number of presentations after the show. This is just anecdotal evidence. It hasn't gotten to the point of having this represented in actual literature, but so far this is a number that is not reassuring. From what we know, in particular with contagion among youth, is that romanticizing suicide has a contagious effect, and that we see increased rates of mimicking and copycat suicide attempts, gestures, and maybe even committed suicide after something's publicly announced or portrayed in the media, if it has certain characteristics about it that makes it more enticing and high risk for copycats. It's been described that romanticizing suicide in itself, so just the word and the way that it's portrayed, can be sort of a risk factor for copycats. And I think that a lot of times the more like the victim the viewers are, it can have an increase. So for teenagers in particular, if they see another teenager, similar demographics, similar surroundings, similar psychosocial issues, the more similar the two, the more the rate is increased. We realize that a lot of people actually did not see the series, and I think it's important for us to know what's going on and what people are watching, what teens are watching in particular, just so that we know how to advise them. I think another part of it is just learning how to talk to kids about this, and patients and parents and whatnot, and how to talk about the symptoms and how to seek help if you need it, and what warning signs are, just to raise awareness for the issues that are underlying the actual suicide, and to provide resources for those who actually need help. I think suicide is something that we're always assessing for. So with any patient interview, it's a question that's always part of our interview. So we want to use the word suicide. We want to ask about suicide. But again, we also want to make sure that people are comfortable talking about that. And we want to make sure that they have an understanding about suicide and what causes suicide and other ways to handle what they're going through besides suicide as well.